I ran it again just a couple of nights ago. Do you know how many articles have been added? 1. So this is an area that we as advocates for Parkinson's disease and people who have Parkinson's disease and care partners need to really push for. This matters. Cognition impairment is prominent. I don't like living with it. Help me do something about it. This area is particularly important because the medications that we use to treat the motor symptoms in Parkinson's disease really don't help cognition at all. There's even some evidence that levodopa may worsen some cognitive functions. So it may actually make some things that you do even harder to do from a mental standpoint. But there's no choice. We have to have it from a physical standpoint. But it certainly doesn't help in any way. We also know that the classic medications used in dementia or for other cognitive issues work sometimes, but don't work particularly well in Parkinson's disease and the cognitive impairment associated with that. So one of the things that we've really got to understand is what precisely is going on here, how to target medications, but that's why a whole host of people now are looking at exercise. Because if exercise helps physically and exercise helps mentally, then why not make that our primary intervention to help with diseases like Parkinson's disease that affect both areas? And so that's why you're seeing this push. So I'm literally presenting to you today all the evidence. You will walk away from here going, I know everything there is to know, because I'm literally going to tell you everything there is to know, unfortunately, because there's not very much to know. But persons with Parkinson's disease do better on cognitive testing when they have better cardiovascular fitness. This becomes really important. Notice that I put up there cardiovascular fitness. So just being stronger isn't enough. Just being flexible isn't enough. So doing yoga-based programs or strength training programs enough or alone are not enough. In order to impact cognition or thinking skills, you have to have a cardiovascular component to that. So when we're talking about what improves brain health, what makes you smarter, it literally is vigorous exercise. And we know that even in Parkinson's disease patients, that vigorous exercise, and I'm going to define that for you, don't be scared of that word, it's not as vigorous as it sounds. But when we define vigorous exercise, actually helps with brain activation. And it helps with brain activation or connectivity or plasticity, that big word I explained a few minutes ago, particularly in the front part of the brain and particularly for executive function. It does not help with memory, actually. So exercise does not help with memory. In the Alzheimer's disease population, it helps a little bit, but there's no evidence yet that people with Parkinson's disease who exercise will have memory improvements. None of the studies done to date have shown that. Matter of fact, they show either no change or even a slight worsening, although it probably is still a no change effect. We do know it drastically affects executive functioning. And again, that really is the area that we're concerned about in Parkinson's disease, so that may not be such a bad thing. So here's one of the studies. It's one that's often cited. They took 28 people who had Parkinson's disease, and they randomized them to 2 groups of 14. And so the first group started, and the second group waited. And when the first group finished the exercise program, then the second group started. And so they compared 2 groups of Parkinson's patients to each other. The exercise program was 2 days a week, 60 minutes at a time. So 2 60-minute sessions is all they did for 12 weeks. The exercise program that they prescribed was both resistance or strengthening exercise as well as cardiovascular. So they did at least 30 minutes of either cycling, treadmill activity, rowing. Swimming was not a part of this study, although people do talk about that. And the targeted heart rate was 60 to 85%. So you may be asking, why are you giving me these details? I don't care. I'm giving them to you because as you work with your own exercise coaches or your own physiotherapists, this is actually what the evidence would say you need to be doing to have brain improvements from exercise. So it needs to be cardiovascular, needs to be at least 30 minutes, needs to be at least 2 sessions a week, and needs to be working you at anywhere from 50, but really 60 to 85% of your heart rate. That's what gets the blood flow going to the brain, which allows you to be able to increase circulation, which allows you to make your brain better. The other component to these exercise programs is that they are progressed over time. So you're not given an exercise program and left alone with it. We actually know that doesn't work well in Parkinson's disease. We know that you need to be reassessed on a fairly routine basis to have your exercise program increased so that it continues to challenge you. For physical gains, that's not so much the case, but particularly if we're talking about brain gains or getting smarter or warding off cognitive decline, we do know that that's necessary. You need to actually increase the exercise program over time. So what did they find? Well, they found improvements in cognition, particularly in that executive function realm, and these were substantial. So the group that exercised got markedly better. The group that didn't exercise had no change at all. When they reversed and put the second group into the exercise program, then they got markedly better as well. So definite changes in executive function, no changes in memory. Interestingly enough, this study reported no changes in quality of life, which they were surprised by. But you have to remember as well, it was about a 12-week program, which may not have been enough time for those changes to register. And we actually know that for a true change to take place, for a true brain-modifying place to happen, you need to exercise for at least 6 to 12 months before we see those changes. So 6 to 12 months, 3 times a week, 30 minutes at a time minimum, exercising at a particular heart rate, and it takes that before we start to see brain level or connectivity level changes. So another little study that was done by a group at the University of Florida, which was just a single case study design, looked at exercising just 20 minutes, 3 times a week for 8 weeks. The only thing that their subject did was use a stationary bike. And she got better as well. Markedly better, not only in terms of executive function, but she actually got better at dual tasking. So they measured how well she could do 2 things at once, both before and after the exercise program. She was substantially better at managing multiple things once she finished her exercise program. She was also better in language, so she didn't have as many word-finding problems. She didn't have as much issue putting her thoughts together, so even that changed. So it's a single case study. We can't tell a lot from that. But the point of presenting you both studies is to say that probably the type of exercise doesn't matter a lot. It's that you're exercising, that you're doing it at a certain intensity, and what is important is the cardiovascular component, right? So whether 30 minutes, 20 minutes, twice a week, 3 times a week, what both these studies have in common is that there's a cardiovascular component at 60 to 85 or 60 to 75% of your maximal heart rate. So those are probably the keys when we're looking at cognitive, maintaining cognitive skills, preventing further cognitive decline, or making you smarter. Those are probably the things that we need to pay most attention to. Spend just a little bit of time on brain training programs. How many people like to do crosswords? Yeah, reading. Yeah. Sudoku. Anybody do that? Okay, yeah, Bob does that. They're good for you. And so lots of times, again, this is one of those things that doctors will say, well, read and do Sudokus and do crossword puzzles, they're good for your brain. But do we actually know they're good for our brain? Again, in the realm of Alzheimer's and in older adults, there are literally, I looked it up, about 3,200 studies in this area. Do you know how many there are in Parkinson's disease? 4. 4 studies. All done within the last really 2 to 5 years. So it becomes important for us to understand, do these brain training programs actually make a difference? Because if you look on the infomercials, they're everywhere, right? Train your brain this, your brain will get better here, do this puzzle, buy this program, buy this little computer thing and do these puzzles. They're everywhere, and they teach us that we're going to be smarter and we're going to get better and we're not going to have as much risk of dementia, but we don't actually know that yet in Parkinson's disease. One little study that is of interest, because a lot of them aren't done very well, actually looked at doing nothing but Sudoku. So 1 Sudoku puzzle a day for 6 months. That's all that was required. And it wasn't even a hard one, it was an easy one. And what they showed is that PD patients who did the Sudoku puzzles every day got faster at doing Sudoku, got better on measures of executive function, so that area that we're most concerned with, and they also had normalization of brain activity. So what they did was look at the brain activity, the connectivity on test of executive function with people who don't have PD, people who have PD and did the Sudoku puzzles, or people who have PD who didn't do the Sudoku puzzles. The PD patients who did not do the Sudoku puzzles had no change. Their brain activation stayed abnormal. But for people who did the Sudoku puzzles, after 6 months, their brain activity looked almost like controls, even though it was different at the beginning. So there wasn't just that those patients looked better from the beginning, their brain patterns actually changed over time. So, and this was an easy, for those of you who do Sudoku, this was literally like a 4x4 block. So these weren't the really hard ones. These weren't the advanced ones because I don't even do those, right? I just go, no. So I can do the crosswords. I have trouble with Sudokus. So I'm not necessarily saying that Sudokus are the absolute way to go. But what I'm saying is there is some early evidence that these brain rehab, brain training programs may actually be a brain exercise similar to what physical exercise does. Because what's similar, they both impact executive function. So we need more research in this area, that's for certain. So how might exercise help cognition of any kind? Well, we know, and I've kind of alluded to it a little bit, better cardiovascular health, better circulation of blood to the brain, better brain health, plain and simple. It's not any more complicated than that, which is why strengthening programs and yoga programs and other more, I'm going to use the word laid back, but I don't mean it that way, less cardiovascular challenging types of programs may actually be good for mobility and stretching and staying flexible, but they won't necessarily do anything for brain health because they're not getting your heart rate up to the point within your safety limits, right? Because everyone's safety limits are different, but within your safety limits to allow you to get better circulation to the brain. So it is important to bring up your cardiovascular effort within your normal safety ranges that are determined by your physician or by the physiotherapist that you work with, which is why one of the recommendations from the ParkFit program is it isn't enough to just go to a general exercise program. Patients actually need an exercise program that's specifically designed for them based on their physical conditioning, based on their existing heart rates, based on all of those factors so that cardiovascular effort can be challenged. We also know there's this thing called BDNF, and that's not a bank or an attorney's group. That's actually brain-derived neurotrophic factor. So it's a huge mouthful. But brain-derived neurotrophic factors are proteins that your brain naturally secretes that actually encourage and maintain brain cells. So it encourages growth of new brain cells and actually maintains the health of existing brain cells or neurons in the brain, okay? So BDNF, we know, increases. It's essential. It's particularly essential in people who have Parkinson's disease because BDNF lowers with Parkinson's disease. Of that, we have no doubt. We actually know that to be true. And what happens when people exercise, and this is true with healthy adults, this is true with people who have dementia, and this is true with animal models as well as human models of Parkinson's disease, BDNF increases. So exercise increases BDNF. BDNF helps to support brain cells. That likely is one of the reasons why it may have a helpful effect for cognition and thinking. We also know that exercise helps with mood, and it helps to lessen depression and anxiety, which also are factors that help improve cognition. We know that when people exercise, they walk and move better, which may encourage them to get out into the community more, to socialize more, to be stimulated more, to interact more. And all of those things are important for maintaining cognition. One of the first things that will affect cognition in Parkinson's disease is social isolation. When we isolate ourselves socially, we're no longer stimulated by conversation or stimulated by socializing with others. That alone, even without any disease advancement, will cause people not to do as well cognitively. That's true for all older adults. It's true for people who have dementia, and it's particularly true in Parkinson's disease. We also know that exercise will help to increase energy, reduce fatigue, helps people to sleep better. When you sleep better, you think better. So I'm operating on about 2.5 hours of sleep right now, so you may not want to believe anything that I'm telling you. I may not be thinking well at all. You can thank Dr. Jog for that. I had a project that needed finishing in the middle of the night, so you can